Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and today we're going to talk about earlobe repair. And this is a really small little procedure, but like anything else, there's no such thing as minor surgery, just minor surgeons. So when you're doing this procedure, to do it right, there's some little pearls that you have to do, and if you pay attention to these things, you can fix these earlobes and people can't even notice that there was anything wrong with it. So we're going to do a simple earlobe repair on a patient that has torn her earlobe from her earrings, which is a very common situation. This procedure takes about 10 minutes. It's done with local anesthesia, and I've marked the little triangle there, and what we do is cut that out on both sides and put this back together. We can put an immediate piercing in there, put an earring in immediately if the patient doesn't want to go without an earring. And so it's a pretty simple procedure with local anesthesia. And we'll go ahead and remove the previous scar. This is the Earlobe Radiowave micro needle. And when you have this set correctly, it's pretty much a bloodless incision. Remove this last little vestige of the scar. And now that we have that removed, we're going to be able to put this back together, which we're going to do in a second. So again, you can see it's virtually bloodless when you use the Earlobe or laser. We put in is called a key suture, and that's the most important suture because that has to line up the border perfectly, and if it's not lined up perfectly, there'll be a notch there. So we put this suture in first, and again, this been here about 6 minutes. So about 12 minutes have passed. Now we've completed this. We use a gut closure, 5/0 gut, because that will dissolve by itself, save the patient a trip. There's the front and the back, and really the whole key to having a good outcome here is how you close the bottom of this. You want to evert that a little bit so it doesn't contract and heal with a notch. These usually heal just fine, and we could pierce it right now by putting an earring through there, or bring the patient back in a couple weeks to pierce it. And if our scar doesn't cooperate and do what we want, then we'll laser it, which makes a huge difference, but we usually don't have to do that. So this is Dr. Joe Niamtu, LoveThatFace.com, showing you a little bit of earlobe repair.